Fellow Kenyans, the national government takes this opportunity to recognize the great work that county governments are doing in response to COVID-19 pandemic. As I have repeatedly said, this is a disease that cannot be tackled by one level of government. This fight requires the entire government and the whole society approach. The collaboration and cooperation between the two levels of government and the people of Kenya has been and has contributed to the gains we have made to fight this pandemic. The national government will continue to work very closely with the county governments and other agencies to strengthen the country's capacity to mitigate against the COVID-19 disease. Today's visit to Machakos County is part of an elaborate plan being implemented by the ministry to inspect the levels of preparedness at the county level and to ascertain the type of support needed. This is important in helping the Ministry of Health to provide support based on the needs per county. Similar visits have been made to Siaya and Kajiado counties and will continue until all the counties have been covered. When we started this fight against coronavirus, our initial focus was on capacity building at various levels. Emphasis was placed on escalating human resources as well as infrastructural capacities. In collaboration with county governments, the ministry rolled out a training of trainers program, and to date, at least 7 healthcare workers per county have been trained. This will now cascade downwards so that all personnel in all counties will have been trained. Today, we can proudly say that over 11,000 healthcare workers across all counties have gone through training. Besides capacity building, the Ministry of Health is committed to improving working conditions of healthcare workers, and we will ensure that their safety at the workplace is a top priority. We are aware that our healthcare workers sometimes work under very difficult environment and very difficult circumstances where they are at risk of contracting the disease from the patients that they manage. This is a major concern of the ministry. To mitigate this, the ministry continues to provide personal protective equipment to various health facilities for use by our health workers. The good news is that we are no longer going to import PPEs anymore. Our local manufacturers are now able to produce better quality than those that we were importing before. The issue of shortage will soon be a thing of the past. Additionally, the national government has committed to support county governments recruit 5,000 community support workers in order to enhance their human resource capacity and in order also to create opportunities for our young people, particularly those in the health working sector. This process is at different stages of completion. Once finalized, the counties will have an additional 5,000 workforce at the expense of the national government. I am happy to note that the Machakos County is among the very first ones that have completed this process. I congratulate you, Governor Mutua. And I'm therefore urging the other counties that have not done so to expedite the process. The restrictions have largely contributed to the low numbers of counties like Machakos, the restrictions and cessation of movement that we have made across the counties as is necessary. For instance, the one in Nairobi and the metropolitan area. This is, however, not to say that Machakos and other counties are completely safe. On the contrary, just like the governor has said, you are at risk, particularly because you are in a transport corridor. And as much as the government will do whatever it can, there will still be errant personnel, errant people, who will come and intrude, break the law, and will be amongst you and possibly infect you. I am told of this story of this truck driver or somebody who got a lift with a truck driver here in Machakos, came up to Kathiani to see the sister, and you know the story. You know what happened. So I'm just saying that let's not think that because Machakos has only got 3 cases so far, that you are safe. I want to tell you to keep it up. Keep up the distances, keep up the hygiene levels, keep up the masks, and that way we might just be able to stay there. To keep the numbers this low, the residents are urged to continue adhering to the containment measures and also exercise the Nyumba Kumi initiative of policing. If you see somebody in your area who has been to Mombasa lately, Nairobi, and other places, you should raise the alarm. I am not saying that you start lynching anybody or beating them up. No. But just raise the alarm. Let us know so that we are able to contain the situation.